In 2017, I went to this place. This place is kind of like the iconic 80s movie, The Breakfast Club. If you haven't seen it, it's a movie about 5 teenagers from different walks of life who all end up in Saturday morning detention. There's a jock, a nerd, a prep, and even a recluse. This isn't the actual movie poster because copyrights are expensive, so let's just pretend. The place that I went to was just like this, but instead of being in Saturday morning detention, I was in a psychiatric hospital. So instead of being around the jock, the nerd, the prep, and the recluse, I was around the schizophrenic, the bipolar, and the depressed. For the first time in my career, I spent 5 days, 120 hours living with the very people that I study. Being in this club of mental health patients taught me several lessons about managing my own illness and also lessons about studying mental health as a research psychologist, lessons that I think can be applied to any field or area of study. Ultimately, the question that I hope to pose to you all today is, how close are you to the experiences of the people in your field? I've always wanted to say this. Welcome to my TEDx. The first lesson I learned in the hospital: sometimes experience is the best teacher. For the longest time, I always believed perfection was possible. In 2011, this mantra from my life was challenged. In 2011, I was diagnosed with an autoimmune disease with symptoms that presented as depression, mood swings, and extreme fatigue when left untreated. The academic all-star and all-around perfect being I was striving for was challenged, and there was absolutely nothing that I could do about it. After a few years of coming to terms with this lifelong illness and its slew of symptoms, I had a genius idea. I decided to stop taking my medication because I felt as though I was fine. I didn't need it. I was miraculously healed. Standing here today, I can tell you all this is the dumbest idea I have ever had. Truly. In this moment of enlightenment, I mistook the stability of my lifelong chronic illness as being cured. After 4 short months, my mental health began to deteriorate, and I started to experience suicidal ideation. Because I've worked on a suicidality research team, I began to recognize these thoughts and these feelings as something that was a bit out of character for me and needed immediate intervention. Much to my family's dismay, I decided to check myself in to an inpatient psychiatric hospital until my hormone levels became stable. But I left that hospital with so much more. Through therapy, I learned to give myself grace. Humbly speaking, I think I'm bright, but at no point could I outsmart my body or a lifelong illness. I also struggled with the fact that none of my education or my training could have prevented this from happening. I began to think to myself, Kia, you are Ivy League educated, you're a psychologist, and you work in the inpatient hospitals that you are now a patient in. How on earth did you get here? This is what constantly played on a loop in my mind. What I went through in the hospital, it can't be captured in a training manual or a textbook. I had to live through this experience to learn how to better manage my illness and to learn the importance of placing the priorities and needs of patients and participants at the forefront of my work. So I ask, how can you continue with your life experiences even when they're difficult? And how can you learn from them? So when I left the hospital, I was so excited. I literally ran out of there. I was gone. But when I was running, I forgot that I now had to explain my 5-day, 120-hour break to my family, my friends, and even my job. This is where lesson number 2 comes in. Stigma never sleeps. I spent so much energy trying to hide this experience. I told people my phone died for 5 days, I lost it, I'm busy. I rarely lie, but I was lying like my life depended on it, mainly because I was embarrassed. My best friend and I even came up with the code name, The Place, to talk about the psychiatric hospital in public, but discreetly. She would say something along the lines of, Kia, do you remember when you were in the place? how they wouldn't allow you to have any string, so you had to tie up your hair with a thong. Girl, that was ridiculous. I can give you guys a tutorial later if you need it, just let me know. But honestly, here I was, someone who tries to eradicate mental health stigma, but yet I was perpetuating it, mainly out of the fear of being deemed an incompetent psychologist. So I asked the question, or implore you to think about, what biases or contradictions do you secretly hold that aren't propelling your field forward, and how can you combat these? So, the SparkNotes version of my TEDx. I'm a psychologist who has an autoimmune disease and who works in inpatient psychiatric hospitals, but then became a patient in one, right? This illness, or this experience, taught me so much about my illness, but what I didn't expect to learn was how to navigate symptoms and the illnesses or mental health disorders of those closest to me. This is where lesson number 4 comes in. Blind spot. Oh, well, okay. This is where lesson number 4 comes in. Blind spots. You know when you're driving and there's that tiny area of the road that you can't quite see in your side view mirror? This is your blind spot. We all know you have a driver's license and you're qualified to be on the road, at least we hope. But we know that you still can't see this area. The blind spots in your field or area of study are just like this. There always will be, no matter how much training or education you have, areas that you can't see through quite clearly or fully understand. We all have blind spots in how we navigate our own lives and also how we interact with others. This became especially true within my family. I grew up in an upper middle class family, but I experienced extreme poverty. I lived in 12 different homes and attended 10 different schools, all before the age of 15. Up until about 5 years ago, unbeknownst to my family and I, the source of the instability in my childhood was due to the undiagnosed symptoms of bipolar II. For nearly 25 years, I and others passed off the symptoms of my parents' behavior as irresponsible, unorganized, and just plain unstable. Even with all of my clinical training and my degrees, I couldn't quite see that my parent was struggling with this illness. This was my blind spot. You can have access to all of the knowledge in the world and still not be able to recognize what you're studying, even if it's right in front of you. How a theory or a concept reads versus how it materializes in real life is 2 very different experiences. I learned this particularly in the hospital, as I said before, to have sympathy for symptoms and then to also have grace for myself. Instead of using these 2 lessons for myself, I now use them for my parent. The empathy I learned in the hospital, you can't teach that. It can't be captured in a lesson plan. As brilliant as my professors are, I don't think that they could have taught this. It is my proximity to the experiences of the people in my field that taught me how to overcome one of my biggest and most personal blind spots, and for this, I'm eternally grateful. Who or what are in your blind spots, and how can you combat these? So I hope you all have been paying attention. I worked really hard on this. The final lesson is give a voice to the voiceless. As I stated before, I spent 5 days, 120 hours living with the very people that I study. Before going into the hospital, I could have told you what the symptoms of schizophrenia are. After leaving the hospital, I can now tell you what it feels like to be a parent with schizophrenia and to have your children removed from the home. And also what it feels like to be deemed as a disruptor rather than a coworker in your place of work, or how it feels to be seen as someone who's an other rather than a parishioner in your place of worship. These life experiences, they weren't captured in my teachings. I, like many others in my field, assume we know what's best for the people we serve, but we could learn so much just by taking the time to bring them to the table and listen to what they have to say. For example, any psychologist could tell you what the symptoms of bipolar II are. someone who's abnormally upbeat, has less of a desire to sleep, and also can become unusually talkative. But do you know what it feels like to be the parent of a bipolar child, or be the child of a bipolar parent? You don't know what day you're going to have her. It's like an on and off switch. It's an inconvenience, but we know it's not our fault. And it's not her fault either. Do you know what it feels like to live with this illness? For instance, when I'm in my manic state, I feel like I can get so much done. I'm so hyper. When I'm in my depressive state, I just feel heavy, like I can't get anything done. My mind is either running with a lot of thoughts or just like blah, blank. These are the lived experiences of my family. Lived experiences are more than just a few adjectives, descriptive words, symptoms. Lived experiences are multifaceted, complex even, and deserve to be reflected in treatment plans, interventions, and programs that seek to benefit a specific population. So, I implore you to think about this final question. Whose voices are reflected in your field? Yours or the people you serve? For so many years, I spent a lot of time trying to separate myself from the experiences of the people in my field. I'm now realizing that it's my proximity to these experiences that make me a caring and compassionate researcher who aims to put the priorities of patients and participants at the forefront of my work, always. I tried really hard not to curse in this TED Talk. We had to go through several edits, several iterations. But I'll say this. I got extremely close to the experiences of the people in my field. Like, I really did, as close as you could. So I implore you all to do the same and see where it takes you, even if it is to a psychiatric hospital. Thank you.